What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how often do you have to hold the patient in the X-ray tech field. Once again, to give you context, I do X-rays at a ER, trauma 3, night shift, but I work so much overtime that I am vastly well knowledged in both daytime and nighttime in my hospital. So I would say that obviously, depending on where you work, your amount of holding the patient can vary. So if you work like at a pediatric place, there's a chance you're going to be holding the patients more often because little humans don't hold still. They move, they stuff. And sometimes the parents will hold, other times the parents are pregnant, other times the parents are very scared of radiation and they're bad. So you'll have to let up and you'll have to hold. Now, as far as adults goes, it will just depend on case by case, but mainly if the patient's bone is you look at it and the way it's laying, or sometimes it's obviously open fracture so you can see the bone sticking out. There's certain stuff over time you'll look at it and you're like, yeah, that's broken, I'm gonna have to cross table. And if the patient's just out of it or in pain or they can't hold the board, you're gonna have to let up and hold the little board and press the button. Other times you may have to hold the board for patients who, let's say that they're passed out, they're intubated, and they broke, their hand, and you try to position them and they won't hold it because they're knocked out. You may have to hold then. Other times patients, they're in pain, you'll still have to be there with them for support and kind of hold their hand because it's in pain to get into the right shot. Obviously, you don't want to do no more damage than already is, so sometimes you may not be doing the most optimal picture. For instance, for a forearm, we know that the X-ray techs like it like this, the rads like it like this. But sometimes they can't supinate the hands like this, so you'll have to shoot it the other way, like this, instead of like that, like AP versus PA. Sometimes you'll have those kind of situations. Obviously, if you do trauma hips, you'll do that too. I would say, as far as holding goes, the dose to us with lead, of course, there's ways to reduce your dose. For instance, if you're gonna hold it and the beam's going this way, don't be standing in the way the beam. Move over to the side or a little bit, or there's little things like that. Or depending on what's it called, if you're gonna shoot with a grid, without a grid, shooting hot, there's variables to reduce your dose. Or if you're for instance, where I work, it's me and a partner working, so usually we'll take turns shooting. I know sometimes that putting the lead is sometimes tedious for certain techs who've been doing it for a long time, and they get lazy and they don't want to do it because it's just one picture, whatever, beep. But the problem is not that it's just one picture, whatever. You're looking at a lifetime dose of radiation. Lifetime. Because maybe that dose you got was insignificant at that moment, but over a lifetime of insignificant, it adds up over time. So always try to wear lead in that kind of exposure, especially if you work in the main and the fluoroscopy. Fluoro, just that shit just everywhere, especially in the main. In the main, sometimes you'll also have to hold the patient too, to position them in the correct spot. Sometimes you'll have the psych patients, you might have to hold them too to get the right x-rays done. Or Sometimes you'll have like patients who have dementia, and they don't understand what you're saying, so you'll have to hold that too. Other times, people post-surgery, they'll get like a C-spine. They'll get like the rods or the little, I forgot what it's called, but in the neck, and you'll have the cross table portable because it just came out of surgery. So you'll have to hold patients in there too. But as far as the dosage goes, I would be more scared if you're holding patients in CT versus X-ray, because right now I'm continuing my CEs, and I've noticed, I've done research on some of the dosage. Like a CAT scan, I think it's like a chest, an abdomen, like one of those is equivalent to 1,000 chest X-rays. So like it's a big difference in the dosage. So I'd be more scared over there versus you holding for something like this. Obviously, depending on who you talk to, like, or if someone's already in the field and they are susceptible to having something like cancer, or they have something that puts them in risk, like if they're pregnant. Obviously, if you're a pregnant tech pushing the button, you're not going to be exactly holding the stuff, because, for your safety of the little one, it's different. So, but there's some places where like they make you hold like ridiculous amount, and it's unsafe. Like, gets to the point to where if your manager starts to tell you about your little dosage meter that you're doing way too much, then they may come in like, yo, like, we're gonna need nurses, or we're gonna need someone else to come hold them, because my techs are like, y'all are ordering too much stuff that they can't get help on, or it's stuff like, PDs. Like, the order sometimes like a bunch of extremities and stuff, and if you got someone who's like a 1 year old, 2 years or lower, they're not going to be just holding still and listening direction, because they're babies, they don't know. So yeah, it's been your boy Miguel. Hope this gives you an insight into my X-ray tech field. But for the most part, I think as long as you're doing everything you were taught in school, and you don't forget your basic 6 feet and all the simple stuff that goes along with the radiation to keep you safe, you should be fine.